Hello, I'm John Wallace, editor of TechNation magazine and with MD Publishing. We're joined today with Danielle McGeary. She's the Vice President of HTM at AAMI. Danielle, I understand that AAMI has a new type of certification for HTM professionals called the Certified Associate in Biomedical Technology, or CABT. Can you tell the TechNation community more about this new certification?
Absolutely. First and foremost, thanks for having me here today. We're very excited about our new certification and definitely want to get the word out to the greater HTM community. So the CABT is basically an entry-level certification for HTM professionals who are either looking to start a career in HTM as career changers or graduates of HTM programs who may not yet be eligible to sit for the CABT. So this is basically a bridge certification to allow HTM professionals to always be certified from the point that they start their career in the HTM field all the way until they're eligible for the CABT, and then they can maintain that throughout the rest of their career.
I understand. Great. So is the CABT just for those starting out in HTM?
Well, yes and no. So in order to be eligible to take the CABT, if you have at least an associate's degree, you need 2 years of experience to be a full qualified CABT. So for people just out of school, the CABT, all you need is a high school diploma to be able to sit for this exam and pass it. So the great thing is students graduating from HTM or BMET programs, they can take it and have a certification the moment that they enter the workforce. It's also great for many other reasons as well. For maybe people in lateral careers such as nursing, respiratory therapy, IT, that want to prove that they meet a minimum knowledge competency to qualify for a job in the HTM field, it's a great certification to get because it shows an employer that they meet that minimum knowledge competency. Now, it doesn't test the hands-on portion, but that part can be taught later. And it also can give people the encouragement to apply for an entry-level BMET job that may not think that they're qualified. And on the other side, it's also great for an employer. If you have two entry-level candidates and one has the CABT certification and the other doesn't, when you're looking at their resume, you automatically know that they meet a minimum knowledge competency in anatomy and physiology, medical equipment that applies to patient care, safety, regulatory, information technology, and problem-solving skills. So it's really great in that aspect as well. And for people who are thinking or on the fence about taking it, it's also a way to show an employer that you've taken the initiative to meet a minimum knowledge competency and obtain a certification to make yourself stand out. And that CABT certification lasts for 5 years, and it's non-renewable, unlike the CABT. So for the CABT, you take the test, you pass. You need to have 30 continuing education credits over 3 years, and those can be obtained, through various ways. But for the CABT, the goal is that after the 5 years, those people will be in the habit of holding a certification, and therefore they'll study and pass the CABT and then keep that for the rest of their career. We're seeing that if you get people entering the field or right out of school, young professionals in the habit of certification right off the bat, they're more apt to keep it and continue it throughout their career.
Great. And I think you already answered this question, but I'll ask it anyway because I had it on my list. But what is AAMI's reasoning behind the new CABT opportunity?
So our main reason for doing this is really just to give everyone an opportunity to have a certification. I think I had mentioned in my previous answer that if you had a degree, you still needed 2 years of experience in the field to be a CABT. If you don't have a degree, it's 4 years of work experience. So this really bridges that gap, and we're just really trying to really elevate the profession.
I know AAMI offers some different certifications, and you've talked about those. Can you share some more information with the TechNation community about the importance of certification?
Absolutely. I mean, certification is very important. So for a couple of reasons. It shows that you've taken the initiative to set yourself aside from your peers. Getting any type of certification, you need to study, you need to meet a minimum knowledge competency, and you need to really just have the initiative in yourself to really go after that.
Is there anything else you would like to add?
Absolutely. So the first testing window for the CABT is September 1st through September 30th. The registration window for the exam is open until September 8th. And you will, for the first round of testing for the CABT, you will have to go to a Criterion test site to actually take the exam. But long term, the goal is that you can actually just take it on your own PC and you won't have to go anywhere.
Danielle, the CABT certification sounds great and it's new. How can somebody prepare for the test or prepare to become certified?
So we're in the process of actually creating a BMAT 101 course. So that course covers the 5 main competency areas of the CABT, and it will also serve as a course for employers to use if they're hiring someone that maybe meets, 90% of the qualifications for the job. Like maybe they've come from an electronics career in a different field but have never worked in a hospital. This course they can take and it'll get them up to speed quick about hospital safety, hospital regulatory, different departments in the hospital, and or maybe that's someone that already works in a hospital that has that healthcare experience but doesn't really understand the electronic side. So this course is really comprehensive at a very basic level, and that will be offered within the next few months or so.
That's a great resource. Well, I know AAMI right now has a travel ban, as a lot of organizations and hospitals do, but hopefully we'll see you soon at either a future MD Expo or at the next AAMI Exchange.
Absolutely. Thank you so much, John, and the whole TechNation team for having me today. And I can't wait to get back out in the field and see you all again soon.